Hello, my name's Steve Fordham.
Hello, my name's Alex Cross.
We're consultants in emergency medicine at the Royal Devon and Exeter Hospital. Thanks for watching this brief video on trauma disrobing.
Once the hospital trauma team or emergency department trauma assessment team has been activated, the resus trolley should be prepared with a trauma mattress topper and sheet. On arrival of the patient, prior to the at-mist handover to the trauma team leader performs a 5-second review in order to exclude the following 3 conditions: complete airway obstruction, massive external hemorrhage, or traumatic cardiac arrest.
Assuming that none of these are present, the patient can then be transferred onto the ED trolley and the ambulance handover can proceed. Once on the trolley, the first action is for 2 members of the ED trauma team to bivalve the patient's clothes along the lines displayed in the picture. The end result should be an exposed supine patient on the scoop stretcher.
The next step is to insert the scoop whilst minimising spinal and pelvic rotation using a modified log roll. The patient should be tilted using the smallest movement possible under direction of the team member at the head. This would normally be under 30 degrees roll to each side.
Each half of the scoop stretcher is removed and then immediately placed back underneath the patient but over the top of the cut clothing. This should result in an exposed patient laying on the scoop stretcher on top of their clothing.
Now, using a minimum of 5 people, the patient on the scoop can be lifted, the clothes from underneath removed, and if indicated, a pelvic binder lain on the sheet at the level of the patient's greater trochanters, and the patient is then lowered back onto the bed.
The end result is an exposed patient lying on a scoop on a clean sheet. By way of a brace on either side, the split scoop is then removed. This provides a fully exposed and disrobed patient ready for completion of the primary survey.
The pelvic binder can then be closed using 2 people with equal traction on either side, and the position is checked by the trauma team leader. We should aspire to have an exposed, pelvis-protected patient ready for primary survey and monitoring application within 1 minute of ambulance handover.
Thank you for watching this trauma disrobing video.